Namaste, I am Dr. Rashmi K. I am a senior homeopathic consultant at Raghav's Homeopathy Multi-Speciality Clinic. I am having around 18 years of homeopathic medical practice experience. I have worked amongst various corporate homeopathic clinics all over India. We are having around 3 branches. One is at Bannerghatta Road and the second one is at BTM Layout and the third branch is at Marathahalli. Psoriasis is one of the chronic skin ailment. In psoriasis, there is excessive multiplication of the cells. Normally, for every 28 days, one layer of cell is formed and it will be dried and fallen off, and then the new layer of cells will be formed. Whereas in case of psoriasis, wherever there are lesions, the multiple layer of the skin is formed. Whereas the superficial layer, there will be no blood supply, so that it will become dried and it will fall in the flakes. Therefore, the psoriatic lesions are called as red raised silvery patches. Wherever we have psoriasis lesion, the skin is little raised and the area of the skin is red. Because of the multiple layer, the superficial layer will be flaky and it will be pure white in color. That's why it is called as silvery scales. So the psoriasis can appear anywhere in the body. If at all it appears in the scalp, we call it as scalp psoriasis. If at all it appears only in the palms and the soles, we call it as Palmoplantar Psoriasis. If at all it appears only in the nails, it is called as nail psoriasis. Whereas the psoriasis appears in various parts of the body, we call it as generalized psoriasis. So many patients consider scalp psoriasis as a dandruff and they'll not be diagnosed properly and they'll be taking various modes of treatment where there will be no cure for it, whereas we should analyze what type of dandruff it is, because there is a condition called as Sebo Psoriasis or seborrheic dermatitis, which is almost similar to psoriasis or which is almost similar to thick dandruff. So when you visit our clinic, we'll do a Woods lamp examination where we can differentiate what type of issue you have, whether it is a seborrheic dermatitis or psoriasis or it is Sebo Psoriasis. Accordingly, we are going to treat you homeopathically so that any kind of psoriasis you are suffering, through Raghav's homeopathic treatment, all your skin ailments will slowly and gradually taper down. Along with homeopathic treatment, we are going to advise you regarding the diet and how to take care of the skin and how to manage the psoriatic patches, so that slow, gradual and permanent relief is what you can expect through homeopathic mode of treatment. One of the complications of psoriasis, what we usually see, if a patient is suffering from psoriasis for more than 10 years, the joint can be affected, where the patient will get the arthritis symptoms. There will be swelling of the joint, there will be stiffness of the joint, and also there will be mild deformity of the joint. This condition is called as psoriatic arthritis. The person who is having psoriatic lesions and then he developed the joint complaints, that condition is called as psoriatic arthritis. It is one of the complications of psoriasis which can be treated through homeopathy easily.